Good evening. My name is Jalen Cave. My priority health issue presentation is on maternal mortality. Maternal mortality is a leading public health indicator as according to Healthy People 2030, its status is getting worse. According to the CDC, maternal mortality refers to the death of a woman during pregnancy, childbirth, or within 42 days following the termination of pregnancy. The significance of maternal mortality. The rates have declined globally, but disparities still exist in the United States. In 2022, there were 22.3 maternal deaths per 100,000 live births. 80% of maternal mortality deaths are preventable. The target goal of Healthy People 2030 is 15.7 maternal deaths per 100,000 live births. While every other race maternal mortality rates have decreased, the rates for Black women have increased. Here are some challenges associated with maternal mortality. Limited access to healthcare. Many Black women, especially in Georgia, live in rural areas. There is a lack of hospitals and healthcare professionals in those areas, making it difficult to receive care. Since 1994, about 40 hospitals, labor, and delivery departments have been closed throughout the state. Racial disparities. Maternal mortality rates of Black women are significantly higher than any other race. Black 50.3, white 14.5, Hispanic 12.4, and Asian 10.7 per 100,000 live births. This is extremely alarming as Black women are a target and are not ensured the same medical care as other races. Here is my fact sheet on maternal mortality. Just trying to bridge the gap. As I stated earlier, maternal mortality is a public health concern and a leading health indicator of Healthy People 2030. The maternal mortality rate continues to worsen along with racial disparities. This fact sheet aims to raise awareness by providing key information, statistics, and further steps on preventing and reducing maternal mortality. What is maternal mortality? Maternal mortality is the number of deaths related to or during pregnancy and childbirth. Some key facts: in 2018, there was 17.4 maternal deaths per 100,000 live births, increasing to 22.3 maternal deaths in 2022. In 2021, the maternal mortality rate for Black women was 69.9 deaths per 100,000 live births, 2.6 times the rate for white women. In 2023, over 700 women died from preventable causes related to pregnancy and childbirth. A death occurred every 2 minutes in 2023. The key factors and causes, I'll get to that on the next slide. But what volunteers and people can do to make a difference is support maternal health programs, raise awareness and educate others on risk factors and health disparities associated, community involvement promoting for policy change and inequities, support women empowerment movements and initiatives, visit CDC site and review the Hear Her campaign. Here is my first social media graphic. Some risk factors of maternal mortality. And some are lack of access to healthcare, existing or pre-pregnancy health conditions, racial and ethnic background, postpartum hemorrhage, obstetric complications, and age. Here are some prevention and risk reduction tips. Regular prenatal checkups, research for skilled healthcare providers, postpartum care, proper nutrition, family and community support. These are all important as women can be vulnerable to maternal mortality. These prevention and risk reduction tips will greatly provide insight and can ultimately reduce the unnecessary rates of maternal mortality. Here is my last social media graphic. Did you know that there is a significant racial disparity in healthcare, making Black women more at risk for maternal mortality? In 2023, the maternal mortality rate of Black women was 50.3 deaths per 100,000 live births, while white was 14.5, Hispanic 12.4, and Asian 10.7. The first online resource is the CDC Maternal Mortality Prevention. The CDC is a federal agency that has been fighting to find ways to prevent and reduce maternal mortality rates. They have started a few initiatives such as the Enhancing Reviews and Surveillance to Eliminate Maternal Mortality Program. This resource is extremely helpful for patients and clients as it monitors the factors associated with maternal mortality and interventions that can help improve the matter. The Hear Her campaign provides great insights on signs and symptoms of maternal mortality while also advocating and bringing awareness to the issue at hand, letting women know they are not alone and have a voice. The next online resource is Healthy Mothers, Healthy Babies Coalition of Georgia. Healthy Mothers, Healthy Babies Coalition of Georgia is a nonprofit organization that is provided for the state of Georgia. They offer many resources such as educational workshops, care and navigation services, and infant mortality prevention. Georgia has the highest rate of maternal mortality in the United States, and Healthy Mothers, Healthy Babies Coalition of Georgia is fighting hard to advocate and provide health initiatives. They also work with policy officials to help drastically improve health outcomes. The third online resource is the Center for Black Women's Wellness. The Center for Black Women's Wellness is a nonprofit organization based in Atlanta, Georgia. The main priority of this organization is to limit the health disparities Black women face as they have the highest rates of maternal mortality. They have a program called the Atlanta Healthy Start, which implements educating individuals on pregnancy and postpartum. They also have a support group called Sister Circle, where it allows for women to come together and share their stories, building a sense of trust and letting them know they are not alone. They also partner with hospitals and agencies to elaborate on maternal mortality concepts to help ensure the safety for Black women. The last online resource is the Wellroot Family Services. This is a nonprofit organization originating in Tucker, Georgia, and has recently been granted $600,000 to continue expanding the program throughout Metro Atlanta. They have a health families home visitation program that offers home visitations to new parents. They help patients by providing guidance on prenatal care, parental skills, and the promotion of healthy pregnancies. The intended audience is for parents who are of lower socioeconomic status.